Hello, my name is Mason Bramble. I'm currently working as a registered nurse at the Phelps Health Emergency Department. Today I'd like to speak with you about the role of effective communication in a healthcare setting. My goal in this speech is to inform you of the various roles that effective communication can play in a healthcare setting. I've worked in various roles in healthcare throughout the years, several years working on the ambulance, working in the emergency department, various roles such as tech, and now as a registered nurse. I also used to work as central dispatch, where communication was key in being able to get people emergency care. In addition to that, I have also taken several nursing courses that emphasize the ability to iterate yourself to promote patient care. Effective communication impacts healthcare team functioning and the delivery of patient care. Effective communication is the exchange of information that is easily understood by the intended audience. So this means that a individual is able to express themselves in a way that the listener is also able to understand and generally able to respond back to the main communicator as well. With communication, it's used in many aspects of healthcare in working as a team, providing patient education, ensuring that patient care is being delivered properly and is the most effective treatment choice for that patient. And that's all decided between the patient care team and the patient working together. Effective communication affects patient care in all aspects. There must be an understanding between the patient care team and the patient on their roles, what their responsibilities are, and expectations for the care. There also must be understanding on the patient side of certain disease processes so that they can assist in bettering their own health outside of the medicinal practices. Also, effective communication can be utilized in helping to build a trusting relationship between a patient care team and the patient. This helps to ensure that patients feel that they're taken care of, seen, and heard on their collaborative care. In addition, patients are also able to make educated decisions about their care if effective communication occurs. And nurses must be able to transition between using medical jargon, speaking with the healthcare team, to translating that to layman's terms when speaking to most patients of the general populace. In addition to patient communication, effective communication is important in functioning as a healthcare team. It's essential for being able to work as a team, to express different ideas or concerns. It's helpful in decreasing misunderstandings and assisting in role conflict. Ineffective communication can contribute to role strain and decrease productivity of a team, while effective communication can increase team productivity and individual team member contribution. Communication is utilized frequently in team settings, and effective communication must occur when individuals are trying to express themselves, discuss different ideas, for that understanding to be reached. This is also important in collaborating with other healthcare teams. In the emergency department in particular, we perform emergency care, but we must collaborate with other team members, such as if someone has some type of renal failure that they possibly need admitted for due to increased creatinine levels, which would indicate that there's decreased renal functioning, then our emergency department doctor may consult with their kidney doctor, more or less. And we also must be able to effectively communicate interventions that we perform in the emergency department to the nurses on the floors whenever we're transferring or admitting a patient. Frequently, independent areas of the patient care must collaborate to increase overall patient well-being. If an individual's cardiologist was not working in collaboration with their nephrologist, which would be a heart and a kidney doctor, they could be working against each other in an overall patient care setting due to different effects of their medications. In conclusion, today we have defined effective communication as an exchange of information that's easily understood by the intended audience. We've also outlined its various roles in healthcare, in promoting patient care, promoting patient understanding of their care, and its functioning in team collaboration. I really hope that you've learned how effective communication has impacted and does impact a healthcare team functioning and the delivery of patient care. In the future, I hope that you consider the effects that you can have by communicating effectively. Thank you.